Welcome to Board Certified, expert interview episodes about medical licensing exams and healthcare careers. I'm Tyler, founder of Achievable, and we offer affordable adaptive online prep courses for the USMLE Step 1, MCAT, PTCE, NPTE, and others. Each course contains everything you need to succeed, including comprehensive study guides, video lessons, thousands of practice questions powered by our memory enhancing algorithm, and full length practice exams. You can get a free trial of any course by going to achievable.me. And if you like it, be sure to use the code podcast to save 10%. Now, let's get started. We've got Becca Guler with us. And Becca, I'd love if you could introduce yourself.
Hi, I'm Dr. Becca Gulair. I have people call me Becca. I left a full-time academic career to do more of this work where I can support a lot of students, honestly, around the world, not just across the US. But I was faculty with a medical school in Texas for 4 years, leading academic support services and career counseling. I also counseled a lot of students through the admissions process to medical school and help students in pipeline programs to improve their MCAT scores. And I have a particular area of interest with the CARS section, which is a section that often does not come with a lot of help. People are kind of on their own with that one. So I have a lot of fun helping people improve in that section. And so now I have my own company, on call advising and consulting. And I still work with a lot of medical students. I do a lot of neurodiversity support work as well with executive function coaching, a lot of test prep as well. And one of my most recent projects is that I wrote the MCAT preparation course through Achievable Test Prep.
Yeah, super excited to have you on here. So, today is our MCAT primer episode, right? So, let's talk about the MCAT. First off, I assume that most of the people who are coming to listen to this probably know that this is the medical college admissions test, and in the name is that it's for admission to medical colleges. But can you specify that more? Who takes the MCAT and what are they trying to do?
Yeah, you would only take the MCAT if you do have an intention to enroll in a medical school. That can be either an MD program or a DO program, which is Doctor of Osteopathy. Those are becoming much more common across the US. So they both use the MCAT exam. Sometimes students will take the MCAT if they are going to like a dental college. They'll use it for a college of optometry as well, would accept the MCAT. And so those are kind of the range of students who would need it, but it's definitely not something you would want to do just for fun. It is designed to measure a range of skills. People are often really surprised at the breadth of knowledge that you have to take the MCAT. So we have the sort of things you would really expect, like chemistry, physics, and those are going to be typically like first year type courses, general chemistry, biochemistry, some organic chemistry, and kind of a year's worth of college physics, perhaps, at least a semester. And then biology and biochemistry. Biochemistry actually shows up in both the biochem section and again, a small bit in the chemistry physics. So there is some overlap across there. The biology is a pretty broad range. There's a lot of zoology, like animal behavior, along with what you might expect from medical school, like the human anatomy, human physiology, how the systems work. Um, and so there's a pretty good bit of science knowledge, but that's actually only half of the test. The other half of the test is composed of two sections. One is the psych soc, is what we often call it, the shorthand. So it's psychology and sociology. So it's basically an introductory level of psychology and sociology. And that is designed in passages. So you have to get really comfortable and efficient with reading the passages because you will need information from the passage itself, which might be brand new to you. But you also then, in the connected questions, some of those questions are going to require you to connect information they gave you in the passage with outside concepts or terms that you had to memorize. It's like concepts from sociology, concepts from psychology that you just have to know coming in. And so that's what's an interesting kind of twist with that section. And then the CARS section, which is critical analysis and reading skills, does not require any outside knowledge. So there's nothing specifically to study content wise for the CARS exam. It's all in the skill of reading and for application. And CARS is designed from really kind of common topics across humanities and social sciences in general. And so you may get passages that appeal to you more, if you like economics or if you like more politically science oriented passages. Some people really love the fine arts passages. Those are not my favorite, when I get like the art history or literature criticisms, things like that. So everyone kind of has topics that they're stronger or weaker with, but it requires a lot of strategy, and you have to try out some different strategies and figure out which ones work best for you when it comes to reading, because the timing is really tough. But people question why we even have the CAR section since it's not in any way science related. And the idea behind it is that they really want to measure how you quickly encounter new information and are able to evaluate that information, get things like the author's purpose, the author's tone, how well they provided evidence or support for their point. The idea being that you're going to need to learn how to do evidence based medicine as a doctor. It's going to be part of your training to be able to regularly encounter new information that comes out in reports, and to need to assess the strength of the theories that they're running on, how they set up their research, et cetera. So on the whole, the test is a very broad measure of what could make you a strong prospective medical student.
Yeah, and it's like you said, it's so broad and pretty advanced. It certainly is a lot larger than, say, the GRE or the GMAT, and it contains a lot more specific things, specific topics, such as physics, right, or chemistry
Right,
that do not show up on those tests. And I find it so interesting that all this stuff falls into the medicine umbrella. I mean, certainly biology makes tons of sense,
right,
obviously. Chemistry makes sense as well because a lot of these are chemical reactions within the body. And then you talked about cars, and that makes sense to me because at the end of the day, you are probably going to be dealing with people's both new information with regards to medicine, but then also like an incomplete set of facts. Like I'm sure if you haven't watched it, you maybe heard of the TV show House, where it's basically like a detective show almost, except for whatever the heck rare thing has gotten this person sick.
right.
I'm curious about the physics being in there is interesting to me, and then the psychosocial aspect does make sense. But I'd love if you could talk about why that's important, especially because a lot of people find it to be pretty different than the rest of the material.
Right. Those are good questions. So with physics, there are really kind of two sides to that. One is that there are processes going on within the human body that involve physics. So, in order to understand cardiology and how blood volume and pressure work, volume and
Mm.
pressure within the chambers of the heart, for example, and also the pressure that happens with respiration, we breathe and then are exhaling, those are physics. And so a lot of those concepts are things that they are occurring within the body as well. And so you need to understand things like the physics of flow and things like the pressure and volume to be able to really understand how those systems work and how the pathologies present. So if someone has a certain illness, what at like the molecular level is going on that's affecting the ability of their heart to fill with blood or to release that blood from one chamber to another. The other side of some of the physics concepts are things like medical interventions, medical equipment that we use, for example. Some of it is electrical, and we may use like electrical charges. So, understanding how some of those foundational physics concepts work help us to understand how those interventions are going to work. Um, I will say, to be totally honest, that the majority of that kind of content, that's what you would have studied in college before coming into medical school, it is used in courses in the very first year of most typical medical programs. It's the first of what are often called the didactic years, where you're not really doing clinical practice yet, where we're gearing up for doing clinical practice at a year or so later. But those really like cellular level, molecular level processes that you have to learn and do in your tests and things during the first year of med school, they will show up on the first board exam, which is known as the USMLE Step 1. And then from that point forward, you can honestly start forgetting most of it because you won't be asked about it beyond that point. So just know, like, if you can get through the MCAT and hold on to a good bit of that information until you take your first board exam, from that point, it really shifts to much more clinical information. And from that point, you're allowed to just look up something you need foundationally if you needed to.
Okay.
With the psych and sociology section, The idea is, one, the psychology information, of course, is the bedrock of psychiatry. And psychiatry is something that it's
Hmm.
not only its own specialty in medicine, its own residency, but we have a severe shortage of psychiatrists in the US. And so most basic psychiatric care for conditions like depression, anxiety, ADHD actually happens in primary care, like in a family practice office, sometimes through an internist, like internal medicine. A lot of geriatricians, also, people working with older folks. There's a lot of psychiatric elements to the care that they provide. So, knowing the basics of psychology, even things like what are the developmental norms? Like at what age do we start to recognize the difference between concrete and abstract concepts? And what's our socialization like? What are the cognitive stages at which we learn? You can imagine that's very important for your pediatrician or a family medicine doctor because they have to know those stages. So the psychiatry, the psychology element is going to be important throughout the study of medicine. Whereas the sociology side, it's the foundation of learning how medical care and access to medical care is greatly affected by a lot of social determinants. Things like power dynamics are something that we're looking at, kind of job people have, whether or not that comes with things like health insurance, understanding how people may feel like they're kind of in an in group or they're part of the out group, and how does that affect their wanting to ask for help or seek services, including things like medical care. And so the sociology content really is the basis for learning all about the different reasons that people may or may not feel comfortable accessing care, or if they seek care but are not able to obtain the care that they need. And so that's where psych social comes from.
That's great. Yeah, that's a really good rundown. Thank you. And I'm curious now, I mean, I'd love to just kind of go a little bit into the key facts around the exam. And the first is that, as people may have inferred by listening to this, it's pretty big
Yes.
and it's pretty challenging. So I'd love if you could talk a bit about how many questions is it, the sections, how much time you get to take the test, and things like that.
Yeah, that's a good question. So the exam does take about 7.5 hours. So it is a full day. And that is assuming that you have standard testing time and standard break time. For students who have disabilities under the ADA, by the way, that's a lot of broad things, including things like ADHD, depression, anxiety, but medical conditions as well. Then they can request additional testing time or additional break time with medical documentation, meaning that their exam may have to be over 2 days because of the length. So once we add an extra testing time or breaks, it may actually be longer. And so the exam is divided into the four sections we mentioned. Those are equal, they're 25% each of the test. And so the time is almost identical for all four of them. The cars section, because it's all reading and everything is based on a passage, you have 9 passages and there will be 5 to 7 questions per passage. And that section is 90 minutes. It's about 5 minutes shorter than the other sections. So the psych soc, chem phys, and biochem sections are 5 minutes longer than cars, and they each have 9 passages with questions that are directly connected to the passage in some way, but they also include 15 independent questions, or they might be called discrete questions. So it would strictly be outside knowledge that you would have from those topics. Anything you need to answer the question, if you need to use a table or a chart or something, they would provide that with the question itself, but it won't be based on a passage.
Very cool. Yeah, I mean, that's a very long test.
Yeah.
I think a lot of the ones that we deal with are in the ballpark of like 1.5 to 3 hours. I'm curious, given that, when do people normally start studying for this, and how long do you recommend that people study for? I mean, obviously, also maybe two recommendations. How long should you study if you can devote sort of semi full time to it, or how long should you study if you're studying part time?
That's a great question. It will differ based on how much time you have available kind of throughout the week, but also it will differ depending on the background that you have. So people are often really surprised to learn that the prerequisites for med school are actually fairly minimal. You don't have to take an anatomy course before going to med school. You don't have to take a physiology course before going to med school. And so sometimes people have the prerequisite courses in biology, which may have been like a general biology, maybe they took a zoology, and they may not have really had much detailed like human physiology. And so they actually have to then learn that content for the MCAT. And so that's an important element for people to look at. If they were a biology major, for example, or a biochemistry major, and those were courses that were part of their program, then it's not going to be the first time that they're seeing that content. They may have to review it a bit. But that's a key element, is to consider, have you had all of this content at some point in your college education? Or is some of it going to be new content that you're learning for the first time for the purpose of the test and for med school itself? So that's a key factor. So if there are any courses that someone has never really had before, I think we need to kind of automatically tack on probably about 3 months in order to be able to get in that new content and become familiar and comfortable with it and practice it. For people who have very part-time studies, so let's say they have like 5 to 10 hours a week, maybe they're working or they're still in school at the time. I think with 5 to 10 hours a week, people need to plan to prep probably about 6 months. Possibly a little shorter if their major was a science major where they really included all of that content in their coursework itself. And for students that are able to do full-time study, then typically 3 to 4 months is going to be right for most people. Sometimes students also will have additional challenges related to like anxiety that comes up a lot when they're taking exams, and that interferes with their thinking process. So we need to allow for more time to either work with a therapist or someone like me who does executive function coaching and test prep, someone who can help you through the thinking process. Not to make assumptions about the question that aren't actually there, not to overthink it and kind of derail yourself when you do actually know the content. It usually takes 2 or 3 extra months of practice to combat the thinking side in those kinds of situations.
Yeah, I mean, you said this probably adds 2 or 3 months a few times. So I'm curious, when do people usually start to think about this? Is it freshman year of college or sophomore year?
Some people go into college thinking about med school already, and some people decide to go to med school in maybe their junior or senior year of college. So it can vary, but people typically would be prepping sometime during their junior year of college if they decided by then that they want to go to med school. And they would be planning to take the exam probably the summer of their junior year, because their medical school applications would be going in like that summer between the junior and senior year. Medical school interviews and the selection process would be happening then throughout their senior year of college. And then they could potentially start then, if they're accepted, that next summer with med school. Sometimes students want to give themselves a gap year before starting medical school. I think honestly, it's a great idea to consider. And so they might wait until their senior year and be prepping for the MCAT and preparing their application during that year. And then the like admissions year, where they would be turning in their app and then having interviews and waiting to hear back, they would typically be working during that year. One great thing that people can do if they have a gap year like that is to do a paid job that is in a clinical setting. And that can be something like being a medical assistant, a phlebotomist, a certified nurse assistant, maybe a medical scribe, or even an EMT if they're willing to do that certification, because it not only shows a level of maturity and having had to have feedback in a professional job, which we're discovering is just something that, by the way, I was on the admissions committee for the medical school that I worked for. So these are conversations I've actually been a part of with an admissions
Mhm.
committee. We noticed a trend, and a lot of program directors for residency programs noticed that they had more and more residents coming in where residency was the student's very first job ever, which was a little disconcerting. And so there definitely is a common consensus among people doing medical missions that they really like to see work experience from students before them coming into medical school, and that often makes them more trainable. So it's a bit of a myth. There used to be a real stigma around having a gap year, like it looked bad on your application. That's what people thought. And sometimes people are still given that advice. But if you're considering that, if you feel like it would be a better fit for you to have that gap year, to wait and prep for the MCAT during your senior year, have the gap year, get more prepared, get more experience. And by the way, you can rack up clinical hours that are then added on your application. So it actually even helps you in the long run with the application. That can be a very good route to go. So that's typically when people would prepare junior, senior year. And sometimes people decide a few years after college, maybe they do go work as an RN or an ENT, and then they decide to go back later. And they typically will take 6 months to a year to really prep for the MCAT, because they may have had a pretty long gap since they've seen that content, and it takes them longer to regain the content. But
Hmm.
that's very viable.
Yeah. So when you're possibly studying for 6 months or more, how do you build a study plan for it? And I would say I'd want to hear both how you would build it, assuming you're going in normally, and then also what do you do if there's a whole section like psychology that you haven't had to take yet, and now you're having to take it and then prepare for the MCAT on it?
Yeah, good question. So Um, I think a key thing I would say is that you're going to find a lot of ready-made study plans for the MCAT or for any exam. This is something I come across a lot with the USMLE exams as well, because I work with students on step one, step two, and step three. But as a learning specialist and someone who works with brain science a lot and advises people on how to learn most effectively, it is really key that you consider your own needs. You think about your background, what you're coming in with, what's new for you, and for things that maybe aren't new for you, but I just know personally, for example, that I'm not great with calculations. I'm slow. I can do it, but I'm just not fast at doing calculations. It's something I just recognized about myself. I know that I may need to look at all the available content that involves calculations on an exam, and I might have to identify a couple of things that are just pretty advanced and they're maybe far outside the scope of what I've previously learned. And I'm not sure that I could really master very well with the time frame I'm looking at. And I might even decide not to worry about those two things out of the maybe 80 options that I have in front of me to work on. And then for the things that I'm working on, I consider how much do I know about this? Am I just kind of refreshing my memory because I've seen it before? The items that are brand new, I consider how do I learn that best? Do I need to pull videos? Do I need to go to Khan Academy videos? Maybe get a really basic intro first and then try doing it in practice problems. But that's a really key thing is to immediately try to put it into practice and to get a variety of practice problems that will have you using different numbers or different variables for the same concept, and making sure that you can apply the formula forwards, but also that you can manipulate that formula if they ask the question from a different angle. That's something that I like with our achievable test prep is that we do have dynamic quiz items that we'll put into the chapters where if you have a practice question coming up again later, if you want to do it again, it will often present you with different variables that would require you to use new numbers, or it might give you different numbers in a question. So that's something I would think about is what do you most need? If you find a pre-made plan from someone and you like the way it's structured, I would then order it to be almost like Lego blocks or something like you can pull the items and switch the order around, put the content that you most need to do first, and whatever they have first, push it to later. So switch around the order so that you're aligning it according to what you most need. And we often psychologically we start with the things that we're more comfortable with, thinking it'll help us warm up, but we'll just get stuck in that stuff and take too much time and not get to the stuff that we really need to be getting to and need longer practice time with. So I think that's key.
Yeah, that sounds really important. In general, I think that was an example of like an approach tip, right?
Mhm. Mhm.
How to approach your study process with the test. Do you have any other tips along those lines that are just general MCAT advice, like strategic or tactical advice?
Yes, one piece of advice I mentioned with cars that it's all strategy and skill because there's no like memorizable external information for it. And I really advise students to strongly consider letting one passage go, because the number of passages and the time that you have, the most advanced readers who have done heavy, heavy practice really have difficulty finishing in the time allowed on that section. So just know that that's the norm. Very few people
Mhm.
actually finish comfortably. But I do highly advise that you identify which passage would be best to let go. So I mentioned that for myself,
Mhm.
I'm not a big fan with the fine arts passages. I've worked on them a lot. I can do them, but I know that I'm probably going to need the longest on those questions to really figure out what they're asking. And that can really eat up time that I could be diverting to other passages that I'm better at, that not just the topic, but like the style of the passage, the way it's written. And at the end of the test, what gets you points is not how much effort you put into everything. It's how many correct items you got. How many correct answers do you have? And so I strongly advise this exam, especially for the car section, be willing to sacrifice one thing. Don't leave it blank. Put guess answers, minus C, no real statistical significance. I just like the letter C. But to have your go to guess answer that you use because you don't want to have to make that decision in the moment. Just put your answer, don't mark it, just move on and redeem that time and use it for those other passages that you can now put a little more effort into and get one or two more correct items out of, because that's what's going to add up to get you a higher score.
Yeah, and I think that actually is a nice segue into how does scoring on the MCAT work? And then what is sort of an average score? What is a good score? What is a Harvard kind of score? Because I know that obviously what is a good score is going to be relative to the institution that you're applying to. So that's a piece of advice for all of you listeners from me, not chipping in here from the side, is go look up what the score percentiles are for the school that you're applying to, right? And you probably want to be above the bottom quartile, but you don't have to be. They still admit a quarter of the people that are in it. But I would love to hear a little bit more about like how the scoring works and what is generally considered a good score.
Okay. So the scoring for each section, and remember there are four, it falls between 118 and 132. The mean and the median for the sections is 125. Um, and the scoring comes from essentially how many items you got correct. So it's not as if
Okay.
every item increases the overall score. There's a little bit of a band where, a few items will result in the same scaled score.
Yeah, that's great advice. Well, thank you so much. This has been Board Certified, hosted by Tyler from Achievable with Becca Goulaire. And Achievable has great online courses for the USMLE Step 1, MCAT, PTCE, NPTE, and more. You can try them all out for free by going to achievable.me.